Welcome to another episode of the Wealthy Podcast. I'm your host, Shauna Nairos, and this week we are back with Dr. Wayne Lai to talk about sleep through the ages. So whether you are a parent of a very young child, baby, infant, toddler, all the way through school, we talk about adolescence, the teen years, adulthood, and all the way into the later decades. We cover it all. We get through it. It's a great conversation. I hope you enjoy it. You're going to want to listen up. We're back on the Wealthy Podcast with my new best friend, Dr. Wayne Lai, to talk about sleep again. It's one of the most powerful determinants of our health, yet it's also one of the first things we sacrifice. And the truth is, the cost is higher than we think. Every missed hour, every restless night, every broken pattern leaves its mark on our mood, our memory, our immune system, and most critically on our brain. What's more, our sleep needs and the brain's reasons for them are constantly changing. From the massive neural growth of infancy to the high-stakes learning years of adolescence, to the hormonal shifts of midlife and the memory-protecting deep sleep of older age, at every stage, our brains depend on sleep in different and essential ways. And when we don't give our brain what it needs in that season of life, the consequences can be detrimental. And this is why I've invited Dr. Wayne back, because we've done a couple of episodes now on sleep, and they're always our most popular. And we always run out of time to really get into some of the nuances around these sleep topics. So that's what we're going to do today. So just as a reminder, Dr. Wayne Lai is a neurologist, board-certified sleep medicine specialist, founder and medical director of Trank Sleep Care, and clinical assistant professor at UBC. If you heard our first conversation, you'll remember that we get into deep insights into why sleep isn't just restorative, it's protective. But this time, we're going to go a little deeper and journey through the human lifespan. So sleep through the ages, uncovering what's happening while we sleep and what's at risk when we don't, from birth to later years. So let's get into it. Welcome back, Dr. Lai.
Well, thank you. Thank you, Shauna, for inviting me back again.
It's great to have you back. And I'm not kidding when I say our sleep episodes are some of our most popular, because it's something that we all share and it's something that we all need. And I think it's something that eludes a lot of us. So I'm so grateful for you coming back, and you're just always such a joy to talk to. So this episode, we're focusing specifically on our different sleep needs throughout our ages. Or different seasons of our lives. But why is it? It's important, I think, to set the context. Why is sleep not a one size fits all?
Good. Awesome. Well, thank you. I'll try my best to deliver the message as much as I can after spending a few restless nights dealing with the basement flood. So for sure.
So you can be our case study. This is what happens when you don't get enough sleep.
Exactly. Your mind and your mental capacity is not as sharp. But you're absolutely correct that sleep is not a one size fits all. It's highly variable, depending on many different factors. Including biological. Certainly, as you mentioned, throughout different stage of our life, we do require different sleep amount. And depending on other medical condition, your mental health, and your social and occupational situation, that requirement can be different. Now, from a biological perspective, certain people are more prone to, or they prefer to go to bed later, what we call the night owl. There are people who prefer to go to bed early or wake up early. We call it the early bird. So there's that genetic variability as well. So that's why when we talk to patients addressing what their sleep needs are, we do have take that into considerations.
Okay, so I just want to hone in on that. It is actually a thing to be a night owl or an early bird. We talked a little bit about this last time, but you're saying it's biologically sort of predetermined.
No, absolutely. And we can discuss that a little bit later today when we are discussing the biological or something called a circadian rhythm. So we are wired a little bit differently. What I would do right now, I'll probably give one example. Like some of the occupation require people to work night. There are people who are just more conditioned to work night, and they can cope the night shift better than other people.
Right.
So those people are probably more conditioned to be able to work night, and they prefer to stay up night working or playing games for that matter, and then they sleep during the daytime. So those people tend to do better, needing a night shift compared to other people.
Interesting. And certainly, like, obviously we work in a hospital, and a hospital is 24/7. I have a really good friend who chooses to work nights, and you always hear how, I'm glad we're going to get into circadian rhythm, but you always hear how disruptive night shifts or shift work can be to the sleep cycle. But what you're saying is that some individuals are actually more it's more conducive to the way that they're sort of biologically arranged. So they can handle it or tolerate it
for sure. And not only that, I think some people actually prefer to work night for various different reasons. One of the common reason I heard from health provider working at nighttime is that it's not as busy, that they don't have to handle lots of patients at one time. They have time to be able to pay attention to some patient closely. So they like that kind of interaction with the patient better. So there's also that social and personal aspect to working night as well. But in addition to biological differences, lifestyle and environmental occupational status does matter as well. People who are more exposed to technology, who are more in tune of working with electronics and light exposure, their circadian rhythm may be changed and shifted as well.
Because of the light exposure.
Exactly. And we'll also get into that when we talk about circadian rhythms, how light affect the release of melatonin and how that play part into regulating our wake and the sleep cycle. Yeah. And also the other medical issue, psychological factors also play parts affecting sleep as well. So the bottom line is that no two are identical. Even though two may go to the bed at the same time, but the amount of sleep, the type of sleep, other things requirement to get a refreshing night of sleep is quite different between two individuals.
Even with the same conditions, right? Same room, same temperature, same time to go to bed, same time to get up.
No,
Their experience
absolutely,
can be completely different.
Yeah, and that's important. When we later we'll get into how many hours of sleep each one of us would require, and that's highly variable as well. Although there are certain studies suggesting certain hours at a different stage of your life are required and recommended, but we need to recognize that there are some people require less sleep, and they are what we call a short sleeper, and there are people required to sleep longer, the long sleeper. And that's important because if we take the recommendation, 6, 7 to 9 or even 10 hours of sleep, if someone who's a short sleeper and we're recommending them to sleep at least 8 hours, they're going to be struggling to maintain that additional hours when it's not really needed for them. So that creates additional layer of anxiety for them. So if they are a short sleeper and they're getting by 4 hours, not just getting by, I mean, they're doing really well. And they when they bed, they fall asleep, let's say 4 hours, they get up really refreshing and they can work throughout the entire day without feeling sleepy. That is great. That's all they needed. There is no need to push them to stay in bed for the additional few hours.
No more sleep shaming. But then, certainly, I love that. And I'm married to a short sleeper, legit. And over the years, I will admit, I've been a sleep shamer because I am a long sleeper. I'm a night owl. I like to sleep. I like my 8 hours. But he can get by on 5 hours. And I'm always like, oh, everything that goes wrong otherwise in his life, for me, it's always like, well, it's because you're not getting enough sleep. But maybe he is, right? Yep. And I do think that especially, and I'm grateful that we're starting to really, really focus more on conversations around the importance of sleep, particularly in terms of brain development and longevity. So much relevance. But at the same time, there's that flip side, the pendulum swings, and then we start sort of like judging people and sleep shaming.
Yeah, for sure.
And all of that.
Yeah, I think last time we did talk about it is the quality of sleep
Yeah.
that matter more than the duration of the sleep. So that's at the end of the day, that's probably what it matters is clinically, do we wake up feeling refreshed? Are you able to function throughout the day? Are you negatively affected by your quote unquote poor sleep or prolonged sleep or reduced sleep? So it will came down to how each individual are presented clinically.
Yeah. And I think that's a really good awareness for people to have. I know since we spoke last time, I will actually just like when I get up in the morning for the first sort of 10 minutes, do that check-in. Like, do I feel refreshed? Because like you can sleep 8 hours and still feel like you got, like run over by a truck. And that's kind of like a good indicator where to start. It's like, I might have only got 6 hours of sleep, but I feel great. Or I got 8 hours and I feel terrible. So even just having that own personal responsibility of checking in is a really big part of the process. Okay, amazing. We got through one question. Okay, so I want to start at the beginning because I brought you back because I had so many questions and you were so great about starting to introduce this idea that sleep isn't one size fits all, and also that our sleep needs change throughout the course of our lives. So let's start at the beginning. Babies, and we're going to talk about babies and not parents of babies, because I also think that's a whole other category. Jason's sitting there smirking. He's a parent of a baby right now. But when we're talking about sleep and infancy, infants and toddlers, so what is for each, like what is actually happening in that sleep stage that shapes their brain development? Why do they need so much sleep?
Yeah, so that's a very important question. And this is, I'm going to jump to my conclusion a little bit.
Yeah.
So that sleep is actually not a resting stage in the sense that your brain is not really resting. If anything, while you sleep, the brain is doing more work than we can think of compared to our daytime,
like waking
involving
hours.
daytime activity. No, exactly. So brain sleeping itself involves so much, including promote of the neural cells, the development of the neuronal network, the emotional, the cognitive development throughout the sleep cycle. So if we take back to a newborn, we all know being a parent in the past, Jason being a new parent now, that we know that they all sleep for a long time. Sometimes for a newborn, they can sleep up to about 17 hours a day.
Yeah, like when you first bring them home, they're fresh.
Yeah, exactly. And
sleepy.
Their sleep tend to be very fragmented in the way that they wake up multiple times throughout the day as well as throughout the night. So for a new parent, it can be quite challenging.
Yeah.
Because they do get interrupted by taking care of the baby. So during those times, there's a rapid neural growth and synapse formation, meaning that the cell are developing connections from one cell to another to be able to facilitate communications. So that's where it started to develop. There's a lot of memory consolidation where in the memory center, the emotional regulation foundation has been laid as well. As it progresses, 6 months to 12 months, the babies continue to sleep quite a bit, maybe up to about 15 hours, but slowly to reduce that hour requirement. And they tend to have more consolidated sleep, meaning that they tend to wake
longer.
up. Yeah, they tend to wake up as not as much, and they're able to sleep longer per each time.
Yeah.
During those times, there's a lot of fine motor skill development. They may also started to have a language acquisition, so they start being able to bubble a little bit, and they may be able to pronounce a few words. As it progresses, the requirement for sleep continue to reduce, maybe up to 14 hours a day. They continue to have more consolidated sleep. Some parents are very lucky that their baby is able to sleep through the night from very early on. Some may require much longer attention, maybe up to 2 years. But during a year, maybe around 2 years time, they should all be able to sleep through the night, maybe waking up maybe one times a night. And during those times, baby are developing more higher cognitive skill. a lot more integration with the emotion, the skill that they get exposed to, stimuli that they get exposed to. So there's a lot of integration and acquisition of new external stimuli.
So I want to ask a couple of questions just with regards to oh gosh, babies and sleep, man. I mean, there's books about this. So you were saying that, you know, each of us is sort of pre-wired in a certain way. My son was like great sleeping through the night, but terrible sleeping through the day. And then I would have friends whose babies would like wake up intermittently through the night, but sleep really great through the day. Is there that variability with babies as well? Like, is it more important? And I say babies, knowing that there's different stages within the baby time, but is there a high degree of variability between babies as well?
No, I think there is. And I'm saying that because I'm not a pediatric sleep specialist.
Yes.
So I don't deal with a lot with babies. I have interacted with people who are specializing in helping infant or toddler to sleep better. So a lot of the strategy being engaged in helping those baby with the parents are conditioning too as well. As we know that conditioning is one of the biggest factor defining our future behavior. So a lot of these techniques are being taught is how do we deal with the baby and how do we condition that baby to respond in certain way. Mm-hmm. When we cycle back to talk about circadian rhythm, a lot of the biological clock can be influenced by external factors such as light. So when the baby are not exposed to appropriate lighting, appropriate external stimuli, their condition may be conditioned incorrectly, leading to some of the trouble that you were describing earlier,
like sleep disturbance.
Exactly. Yeah. So I guess one of the things that I learned as a parent is that if baby is crying, you can stay away and let it cry, or you can do certain technique to help baby knowing when they need to do certain things. It's like how we're training our pet, our dog, for example. Mm-hmm. So over a course of period of time, they get conditioned and they tend to sleep better in that regard. So similar things been done for adult, which, you know, the principle is the same,
right?
But obviously the technique will be different with the adults. But it's the conditioning response is very important. Even though we have a biological variability, we are able to condition certain individual to respond to a certain condition similarly.
And I think that's really important because even as we get into other stages of life, this idea, I call it sleep hygiene, but of having consistency and routine and habit and training around sleep habits. That is a parent's responsibility, I think, for, you know, when you have babies, young children, to help them establish that rhythm, that, what do you want to call it? Like a framework for sleep. So, I mean, you know, you also hear anecdotally, it's like, oh, my baby just sleeps whenever and like this and that. And I'm being a Virgo, I was always like, no, like there's like set nap times and set schedules and all of this. And I'm not saying either one is right or wrong, but the idea that as parents, part of our job is to help teach our babies how to maintain an optimal sleep schedule.
No, absolutely. I think our how parents condition our baby, it does matter, in my opinion. Even when they are more in adolescent or teenager, how we model ourselves to our kids also matter as well.
Mm-hmm. Yeah, right. Darn it. They're always watching us. So I'm going to fast forward a little bit, talking about children, sort of school age and, you know, maybe a little bit older preteen, but a recent Canadian survey showed that 20 to 30% of children and adolescents sleep less than recommended. I want to ask, how much sleep do school age children need? I want to ask you about like bedtimes, It's very watery, I think. Some children go to bed quite early, some children go to bed quite late. And again, I really do feel like parents have some responsibility here in creating the container for kids to develop good sleep habits. So let's start the way we want to go on.
Mm-hmm.
Like, how much sleep should they be getting? When should they be going to bed? Like, give us the rules, Dr.
For sure,
Lai.
yeah. So again, there's no one set rule that apply to all different ages or group. If we to look at adult first, a lot of the data are surrounding what are the duration of sleep that we need to reduce mortality. Based on the current data, it's appear to be like more a bell curve. So anything less than 6 hours of sleep, it tend to have reduced longevity, and anything more than 9 hours of sleep tend to have reduced longevity. So that 6 to 9 hours of sleep tend to be the sweet spot in the population sense.
Right.
But keep in mind that there are people who are short sleeper, who are long sleeper.
Right.
But in overall, that's sort of a general guideline I provide to my patient is that 6 to 9 hours of sleep. Now in kids, generally it's different as well. And even through adult life, if you look at age of 30 versus someone who is 60 or 70, it's also quite different, as we know that as we age, the requirement for sleep duration tend to be less as well. So you do have to keep that in mind. Now, in general, in kids, if you're looking at elementary kids, the recommended time of sleep is usually around 10 to 12 hours of sleep.
Okay.
In the middle school, maybe 9 to 11. In high school, roughly about 8 to 10 hours of sleep. So those are the recommended based on the Canadian Pediatric Guideline and American Academy of Sleep Medicines. So now you also asked about what time is recommended for them to go to sleep. Obviously, for a younger kid, we would prefer them to go to bed early to achieve that 10 to 12 hours of sleep if they have to wake up the next day to go to school.
Right.
So 7:30, 8 o'clock is generally a recommended time. In middle school, 8 to 9, and then high school 9:30 to about 11-ish is the recommended time for them to go to bed to achieve that
duration.
Optimal. Exactly. And then I think later on we'll probably talk about teenagers tend to have a delay circadian rhythm or their biological clock. So there are some group of people that are advocating school should start later for them to be able to sleep later to obtain that required duration of sleep.
Totally. Oh, I can't wait to have that conversation because I try to keep my opinions to myself on the podcast, but I have opinions on that. When I was a kid, I remember we would have naps at school, but we don't do that anymore. Do you think that would be a good thing also to bring back? Like younger kids, like, kindergarten, because now kindergarten is all day. Actually, back in the day when I went to kindergarten, it was half a day. Kindergarten, grade 1, grade 2, where they're still really needing like that amount of sleep. I don't know. What do you think?
I think I'll be exerting my personal opinion as well. But if we look at the guideline right now, a lot of guidelines regarding to insomnia management. So for insomniac patients, people already have trouble sleeping at nighttime. We don't recommend napping. But if you look at the European guidelines, napping is allowed because that's part of their culture. Yeah. So is the napping. So the napping is also a culture in Asia as well. So growing up, we are required to take nap. Like after lunch, it's half an hour to 45 minutes of napping time, and everyone is required to nap. At least pretending to nap. And then even in kindergarten, they also have a dedicated nap time as well. Even in workplace in Asia, they allow employees to nap for half an hour after lunch as well. So it's part of their culture. And if that's something that they be conditioned to and they feel great, they have that extra boost of resting and more energy throughout the day. I don't tend to change that. So it's a lot of it's cultural things. But for people who have insomnia, who already have a trouble falling asleep, I tend to advise them not to nap.
Okay, yes. And so I'm like trying to change the world just by having conversations. But like in Asia and Europe, where children have learned how to nap. I think part of the problem we have in our sort of North American culture is that we're actually like bad nappers also, right? Like I can't just put a mat down in my office and fall asleep. Like I couldn't. I just am not conditioned to do that. So do you think possibly also that the early conditioning, like we were talking about, is setting the container for good sleep habits, which at a young age is established napping patterns, sets adults up to perhaps maybe not be, listen, I'm not a scientist, but maybe not be insomniacs. Like I think of Brad in our office who's like always an insomniac, right?
Yeah.
Like, what do you think about that?
Yeah. So I'll give you an interesting example. So I was back in Taiwan, this is about a year ago, and we're working with a biomedical technology in Asia right now. So I had a meeting with them, and the meeting started about 9 o'clock and it ended about 12:30, maybe 1 o'clock. So when I walked out of that meeting room, I found out the entire office the light was completely turned off. And I was wondering, why is it all turned off at 1 o'clock? And it turns out that that's their napping time.
Wow.
So the entire office, they're all napping.
Amazing.
It was kind of interesting to see that. It kind of remind me of how I go through my high school and elementary school in Taiwan, where you're required to take a nap half an hour, 45 minutes after your lunch.
Yeah.
Yeah. And it cycle back to the napping throughout the day. I think my personal take is that, and this is similar to my personal view on using electronic before bedtime as well. Obviously, exposing to electronic, there's a light that prevents the release of melatonin, which is required for sleep initiation. But more importantly, though, is that downtime that we have, because napping to me, obviously, it's resting, but also allow your body and your mental to reset during those time. Because if we are engaged ourselves in the heightened situation where your nerve and your sympathetic activity is very heightened throughout the day, it takes a lot longer time to wind down to the baseline before you go to bed at nighttime. But if you're able to allow to go up here and then kind of wind down a little bit and then go up again, not only you allow your body to reset, but you have a lot more threshold before you reach your maximum or your capacity. So that's kind of my personal take, is that it's not just the act of sleeping, but it's the opportunity for people, for the body and the mind to wind down a little bit.
Arden and I, we're gonna lobby the KGH Foundation leadership team to have quiet time from 1 to 2. Wouldn't that be amazing?
Yeah. And but that's maybe why I think our labor law do require employee to have 15 minutes of nap every 4 hours of continual work.
Really?
Yeah, I think there's 15 minutes of requirement, or it can be consolidated into lunchtime.
Yeah.
So in our clinic, during COVID, we have started a policy where employee are allowed to go out for a walk. They will get a pay 15 minutes walk time. Yeah. As long as they don't have their phone with them.
Oh, I can't. Head exploding emoji. Yeah. That's amazing.
Yeah. So that's a way of us helping employee to be able to increase their productivity.
But not now, like only COVID.
Oh, they still do now.
They still do.
Some people still do take a walk. Yeah. And I try to take a walk too as well if I have the chance. Sometimes I do have a little dog. It's a Bichon. So I would take the dog to my office. Yeah. And my staff would walk the dog as a way of kind of relaxing as well.
Oh, that is amazing. Oh, wow. It's just interesting. You know, back in the day, dating myself here, but just reflecting on the opportunity that we have to integrate some of these practices into work culture. Back in the day, we used to get 15 minutes. You're like, do you know where I'm going with this? For a smoke break.
Oh, okay.
Like I remember when I first started working, it would be like you get a 15-minute smoke break and then like a half an hour for lunch. And then you get another 15-minute smoke break in the afternoon. And I would always reflect, because the thing is, back then also we didn't have phones. So what people would do is they would go outside and have a smoke, but just like contemplate their navel. You know what I mean? Like we just like look around and like think about life. And you know, okay, there was a period of time when I was a smoker, but then when I wasn't, I was always like, it's not fair. Like I want to be able to go outside and just like look around and contemplate life. But there wasn't that. It was like for a smoking thing. So I was always sort of like, we need to bring back the smoke break, but it's not a smoke break. It's like a quiet break.
Yep.
Walk a Bichon break. Yes. Yeah. Okay, I know. I've digressed a little bit. But I do think that's a really important conversation, that like this idea of integrating quieter practices into work culture. And I didn't know that in Europe and in Asian cultures. It's part of them.
I think they also, if I recall correctly, this is in Europe as well. Some of the high-tech company, they would purposely shut down electricity throughout the day so that the employee cannot work at all.
Yeah.
And I've also seen some footage where the computer, the entire desk get lifted off. And then, so the idea is that they're forcing employee to not working during that break time so that they come back more rejuvenated, so to speak.
And productive.
Exactly.
Yeah. I think it would be a huge jarring transition if all of a sudden we went from no napping at work to like nap time. Like I wouldn't even know what to do with myself. Like I could probably sit there and be quiet, but like we would have to train ourselves to get used to that again. But I think it's a worthy activity. So I want to transition into, you referenced a little bit, older children, sort of like preteen, teenagers. It definitely is a very productive stage for brain development, right? So what's different about the sleep architecture for preteens compared to younger kids? And then as we transition into that teenager time period.
For sure. Yeah, for sure. So for starter, for younger children, as mentioned earlier, that they tend to sleep longer and more. And as the teenager, adolescent comes around, they tend to require less of a sleep. But not only that, in younger kids, they spend more time in REM, actually slow wave sleep, to the deep stage of sleep. So just to define a little bit, so deep stage are considered a stage 3 and 4, also sometimes referred as a slow wave. And that literally means that your brain has the slowest frequency during those periods. So during that slow wave or the deep stage of the sleep, there's a lot of memory consolidation and reorganizations. So this thing that we learn throughout the day, it gets stored in the short-term memory area called hippocampus.
Right.
As while we're sleeping, those things get reorganized and then transferred to a long-term memory center. So that's when that deep stage, when the activity happened during that deep stage, and kids tend to spend more time in deep stage. As it progresses, they have less of a deep stage, but increasing proportion of the REM sleep where brain is really active. And during that time, things can happen such as integration of more of a memory attachment to a certain event. Some of the procedural thing that you learn throughout the day get also consolidated as well. So there's a lot of integration of different things into these long-term memory boxes.
So like more complicated memories, not just sort of the memory itself, but the associations that come with it.
No, exactly. So if we take example, I'm trying to think about what example I can kind of relate to the audience so they can understand better. Is that if you to think of short-term memory as a note-taking, right? If you attend the classes, you take everything down on the one page of a paper, and you're note-taking essentially. So those notes get taken throughout the lecture time, when you come home at the end of the day, you wanted to reorganize that into something that you can recall better, right?
Right.
So you put that kind of note, reorganize that a little bit, and then essentially put it into a long-term memory area.
You file it.
Yeah, so that note-taking, that reorganization probably happened in the deep stage of the sleep, but that filing to that long-term memory and integrating other aspect of the emotion, things that you learn, the procedure memory attached to that that task is happened during REM sleep. For example, if you take down a note and that note associated with some kind of joke, right? You're integrating that joke into that memory, that task. It allows you to remember better. So that's where that happened. The integration happened during REM sleep.
So it's like, okay, as you were talking, I was like, it's like when you have your desktop, right? And when I'm working on stuff, sometimes I'll just save it to my desktop. It's like I'm actually picturing your brain and just like the hippocampus.
Yep.
That's the short-term memory area.
That's correct.
Is like a desktop, and you just like pin things there. Oh, I'll come back to that later. I'm going to come back to that later. I'll file that away later, right? And then all of a sudden you realize your desktop is just like littered in like things, and you can't, there's no more room for any more things. And either you file it or you like lose the thing.
No, exactly. Or you
my very pedestrian way.
Upload it to a cloud space or bigger hard drive.
That's right. But you like go back to it, and you're like, so when you go to sleep, it's like going back to the desktop and filing away all of the information that's worth keeping.
Exactly. And so you can recall, because if you don't store your memory from short-term to long-term, those short-term memory, they don't get retained.
Yeah.
And there's a limited capacity. So a lot of college student like a lot of my friends, sometimes they would cramp the night before, and they keep everything on their notepad or their short-term memory, and they do really well on
the desktop,
but the very next day they don't get consolidated, and they kind of forget about it too as well. So there's that process of acquiring memory, retained in the short term, consolidating into the long-term memory, integrating all the emotion attached to it.
I just have so many thoughts on that, actually, now that you bring up like students and study habits and cramming and all of that stuff. I have 2 kids that are sort of like late teens, on the verge of university and all of that, but the cramming thing, and also just like the way that we like deliver school, right? Where like it's sort of conducing to this cramming idea, because it's like, okay, you do a module on, cellular biology, and then you have a test, right? So it's like, oh, now I'm going to like cram, right. And then I have the test, but then it all goes away. But we should know better than that.
Yeah, for sure. Absolutely.
Yeah. Well, Dr. Lai knows better than that. And now all you know better than that.
If I may, I think going back to the difference between adolescent and the younger kid.
Yeah.
We also mentioned that in adolescent, their circadian rhythm get delayed or shifted later, which means that the melatonin, which is the quote unquote sleeping hormone required to induce sleep, get released later.
Oh, okay.
Yeah,
so a later bedtime is actually like optimal.
Exactly. So the what we call the sleep onset, when the melatonin first get released, it's where the sleep onset will begin. And it takes about 1 to 2 hours to actually feel sleepy. So for example, if your melatonin is released at 7 o'clock, ideally 8 to 9, you might feel sleepy, and then you can fall asleep at the time that you go to bed. But if the release of melatonin gets delayed or pushed to a later time, let's say 9 o'clock, which means that this teenager probably won't feel sleepy until about 11. So that's where that shift happened during adolescence, where there's a lot of different hormonal changes during puberty or pre-puberty period.
So I'm going to actually ask you about, I probably have this later on, but looking at my list of questions, I'm probably not going to get to them again. I want to ask you about circadian rhythm, because it is really an important thread that weaves through all of this. So what is the circadian rhythm, and what is happening, what influences it, and why is it so important to understand it when we're talking about sleep?
Yeah, so circadian rhythm is the innate biological clock. Think of your watch. It's kind of that watch. It kind of slowly go and then dictate what happened in your body throughout the day and throughout the night. So circadian rhythm are controlled by your hormonal changes as well as external stimuli, particularly with the light exposure.
Right, like sunlight. Or any light, I guess.
Any light, even fluorescent light. So sometimes, if possible, we do, as part of a therapy, we do ask patients to expose to sunlight if they go outside. But winter time in Canada can be really long, and sometimes to set that circadian rhythm, you do need to use artificial light. And there are certain light that you can purchase online or on the market. It has at least 10,000 lux of light. You need to have a certain intensity to achieve that benefit.
Okay.
So at least 10,000 to 25,000 lux of intensity. And so when we expose to light, light travels through our retina to a structure called suprachiasmatic nucleus. It is a structure within hypothalamus, which in return would send a signal to pineal gland. That's where melatonin get produced and released. So when you expose to light, signal travel through your eye, goes to your brain, and then sending an inhibitory signal to pineal gland to reduce or stop the secretion of melatonin,
which is like the sleep hormone.
Exactly. So if you imagine that if you have the melatonin being inhibited by light, the more that you expose to light, the later you expose to light, it will delay the release of melatonin, later for your sleep onset.
Okay, so I'm in my bed and I'm sleeping, and the sun comes up and it comes through the window, and do my eyes sense that sleep, and that's what wakes me up naturally with the day? Or do I have to open my eyes to like register that there's light there?
You do so you do have light shining through your eyelids, so you can still expose to light to some extent. It's probably not as strong as you open your eyelid and then have a direct exposure. But that's a very good question, because when patient who had a delayed phase circadian rhythm where they tend to wake up later throughout the day, we use early morning light exposure to help adjusting their circadian rhythm, what we call it the van. So we are shifting their time earlier so they can go to bed earlier and wake up earlier by giving them a light exposure early in the morning.
Yes. And my understanding of circadian rhythm is that it is absolutely tied to light and hormone regulation. So like the onset sleep hormone, which is melatonin, and then the waking, like, is it okay? We just totally had this discussion yesterday in our meeting about cortisol. Is that the wake up one?
So there are two processes that are regulating your sleep cycle. The circadian rhythm is that light exposure, the suprachiasmatic nucleus. There's also another process called process S. Stands for homeostasis.
Okay.
So that basically is the balance between wakefulness hormone versus the sleeping reducing hormone, inducing hormone. So it's more of a teeter-totter, where if you have more of the wakefulness hormone being predominant, less of the sleeping inducing agent, then you tend to be more awake. Right? At nighttime, you have a shifting of that the balance.
The dark comes, the melatonin clicks on.
Exactly. So somebody wakefulness hormone, including norepinephrine, serotonin, histamine, for example. That's why when you take antihistamine,
you get sleepy.
Exactly. And you take serotonin like SSRI, people tend to be more energized, they have a better mood, that type of thing. And dopamine can also have the same effect as well. There is one specific hormone called hypocretin or orexin. It is the hormone specifically involving in inducing wakefulness. So people who have reduced level of hypocretin/orexin, it's the same hormone but have two different names because they would identify by two different people. So either orexin or hypocretin, if they have a reduction level of that, people can have a condition called narcolepsy.
Okay. Yeah.
So that's the hormone that we can actually assay from a CSF level. We don't do it routinely because it involving put a needle in your spine, take the water, and then send it to assay. And that can only be done in a research center like in Stanford. So we don't do that as much now, but we can actually determine that there is a lower wakefulness hormone called orexins in that particular individual who's been diagnosed with narcolepsy.
Wow. Amazing. Circling back then to sort of circadian rhythms and the shifting of circadian rhythms, which is your natural wake sleep cycle, right? Teenagers and young adults, teenagers in particular, get a bad rap because and listen, in my house it was this way. Like, they want to stay up later and they want to sleep in late. Like, getting my son out of bed was hard, like really hard. But what you're saying is that that's predictable.
It is predictable. So it's it's a normal biological process. But there's also a way of addressing that, especially if such, I don't want to say behavior, but such
lifestyle factors
are affecting their other obligations,
right.
Social obligations like going to school or work, for example. Then certainly that need to be addressed, unless there are other way of addressing the obligations. Like if the children are able to go to bed or go to school later, they can sleep in later, or your employer allow you to work later, allow you to work more at nighttime, then that can be changed. So sleeping late and waking up late itself is not an issue,
right?
Unless it's affecting
other aspects of your life.
Exactly.
Yeah. And so there is a biological basis for the case to delay school start times, particularly for like, what do you call it? Like secondary school students, grade 9 to 12, because their circadian rhythm is shifting. They still do need, 7 to 9 hours of sleep?
Yep. 8 to 10. Yep.
8 to 10. 8 to 10. And as you've so eloquently outlined, they're probably not sleepy at 9 o'clock. So this is where the case for extending or having school start later sort of comes in, correct? Would you do that if you were in charge of the whole world?
No, I was asked that question when I did a presentation in Samaram.
Yeah.
Quite a few years ago. My response at the time was that I'm not totally against school making the changes on the starting school time. My thought at the time was that those behavior is not considered a norm or standard. By adjusting school time, we actually normalize the quote unquote non-conventional or non-standard or consider a good behavior, right? So we're making changes to work quote unquote bad behavior in some people's view.
Right. Okay.
So in my view at the time was that, is that really something we should do, right? Or should we do something more proactive and more productive, is try to shift their biological clock a little bit earlier by implementing good sleep hygiene. Okay. And part of that is good sleep hygiene involving parental involvement as well. As we discussed earlier, as a parent, we are working until 11 o'clock on the phone, on electronic, watching TV, whatever, and we're telling our children to go to bed at 9 o'clock and not exposed to electronics. Yeah. So to me, it wasn't quite the way I envisioned it. Like if we are able to recondition our children to an earlier time and it's achievable, then maybe we can also use some of the time that we are together as a family time as well. So this way that we don't have to change our school hours. Now, my opinion have changed over the year. I am not really opposed to delay the school starting time, but there's a lot of logistic and other things that we need to consider as well, including, so, if children starting school, let's say at 10 o'clock, so as a parent, if you have to work at 8 or 8:30,
Yeah.
so how are you getting your children to school? That is a whole other social obligation and change that to happen around changing the time for children. So I mean, it's a tough question.
I know.
There is an argument for either side. But at the end of the day, that we want to do anything that's best for our children.
You're so diplomatic about the whole thing. I really think, I mean, I am a proponent for maybe a later start time. I understand the logistical challenges that are embedded in that, but I also just think humans are super creative and we could figure out something. But I really appreciate what you said about the world we live in actually starts, I start work at 9, 8:30, 8 o'clock, but I'm a night owl and I like to sleep in. I'd like to start later, but the world doesn't adjust for me. So sometimes we have to adjust for the world that we live in. Yeah. And there are a lot of factors that we can control in terms of our children's sleep hygiene, especially young adults, right? Particularly exposure to screens, like you said, and habits around winding down at the end of the night, that I also think that maybe sometimes as parents, there's a lot of tension around implementing those boundaries and that we just don't do it. Therefore, the challenge is exacerbated by the fact that kids are on screens late, that they have access to their phones in their bedrooms. And I'm just as guilty as the next person for this, all night long. And therefore their sleep is short and potentially disrupted, right? So there are things that we can do to mitigate the fact that they still have to get up in the morning and go to school.
Yeah, no, for sure. And as a parent, I share the same agony as well. And I do feel that if I had the opportunity to go back again, I probably would intervene a lot earlier. Yeah. Because once the conditions are being set, it's really hard to change that behavior. So if I had a chance to go back to COVID time, if I were able to say to my children that, let's not be on the phone during dinner or, half an hour before the bed, let's kind of get together, do something. Mm-hmm. Maybe if I were able to go back and set that pattern early, it might be a different kind of outcome for me. So this is for all the new young parents. You wanted to be able to set that good sleep hygiene for your children as early as possible,
so that it's not as contentious later on. Right. I agree with you on that one for sure. My first kid, we didn't know. We just, like, all of this technology was just sort of emerging, right? Jack's 21 now. And so he had the phone and we didn't really, we really didn't know. The second kid, who was a little more agreeable, to be honest, we were like, okay, give us the phone and blah, blah, blah. And but early, right? Like younger. Mm-hmm. And so it wasn't as contentious. Whereas the other one was older and was like, no, I want him. All my friends are on it, So it was a lot easier with the younger one because we started earlier and we were able to hang on to that habit for a lot longer.
Yeah. For sure. And on that note, I know some of the school, maybe not in Canada, they are restricting the use of phone at school right now.
They are.
Yeah. Are they doing that right now in Canada? Oh, okay. Yeah. And I think that's a great idea. Yeah. Just because, kids are on the phone like all the time right now, and having that bit of a downtime away from phone, and they should be able to be more focused with the school education.
Yeah. Totally. Oh my gosh, how do we always run out of time? I want to talk about adulthood, okay? Because like a lot of us are adults and a lot of us struggle with sleep. And I know we talked quite a bit about this on the last time we were together. But it is a very complicated, busy time of life. And probably, for the first time, if you're a parent or even otherwise, you're focusing adults are focused. There's so many competing demands that no longer are we just sort of like focusing on ourselves, whether it's kids or career or, you know, aging parents or what have you. There's a lot. From a neurological standpoint, even though, you know, we hear a lot about the brain development for children and young adults up to the age of 25, are we done like when we get to adulthood, or why is it still important, and even more important maybe, to continue to be vigilant about our sleep habits?
Yeah, for sure. Absolutely. Yeah. So before I tackle that question, I do wanted to cycle back to children.
Yeah.
There's two important points I'd like to make. One of which is that when children are not sleeping well at home, they are less attentive at school. Therefore, their academic performance can be affected. So, and obviously their behavior can be more emotional, more irritable, things of that nature. I think the important thing to note is that some of those behavior can be attributed to poor sleep quality, so that those behavior not being mislabeled as acting out, or ultimately some of those children being labeled with ADHD.
Right.
So some of the studies suggesting that a lot of ADHD children are actually due to the fact that they don't sleep well, but they get mislabeled with ADHD from their early on life, and they get put on stimulants for their entire life. When in fact that is the sleep quality need to be addressed. So that's one thing I wanted to just point out to the parent and also to educator, that please consider sleep quality as part of your investigations. It's not just acting out. It's not just this kid is not doing well, maybe have ADHD, let's put him on a stimulant. It is more than just that. And obviously nutrition is important, but sleep definitely is one of the things that I would be on my radar.
It's so interesting that you say that. My daughter does have ADHD and she gets optimal sleep, but we never had that conversation as part of the diagnosis. It wasn't like, how long does she sleep? What is the quality of sleep? Does she wake up tired? You know, that kind of thing. Like, that wasn't a variable factor for us. Sure. But I can see how it would manifest as symptomatic of ADHD like behaviors.
For sure. Yeah, no, absolutely. So in the younger population, which I don't deal as often, but the concern is usually their development, right? Their emotional, their mental mental status, their brain development. It's those things that we're actually more concerned about. In later in adulthood, it's more of the long-term physical complications, also brain complications such as Alzheimer's, dementia, development, and also the risk of having heart attack and stroke if you don't sleep well. And so that does increase your overall cardiovascular risk. So in older population, cycle back to your question, it's more focusing on preventing those long-term complications.
And we talked about this last time, but now I'm going back to like the desktop, because I know when I have a bad sleep, like where I wake up in the morning, I do that little check and I'm just like, ugh, like I could use more sleep for sure. And it really doesn't have to do with duration. Sometimes I eat chips before I go to bed, and we talked about this last time, and it makes my sleep suck, right? Yep. And there's good reasons for that. We won't get into that, but like, it disrupts my sleep to the degree that I don't get into that deep sleep until later in the evening. And then I wake up and I feel like crap. But I also know that like my desktop is still got so much stuff on it. And I can't seem to sort out what meeting we talked about this or that, and was Art in there or was she not there? And like, I feel like that is worse now that I'm 50.
For sure.
Is that a thing?
No, absolutely. So there's also what's called a pruning. So neural pruning, like while we're sleeping, we do discard and excrete it out some of the unwanted waste. or some of the
Yes.
toxin generated throughout the day.
The vacuum cleaner.
Yeah, exactly. So one of the example I often use is also, if you have a cup that you keep on pulling water, those are the waste waters. Maybe I can use my sump pump as an analogy then as well, right? You have a
Oh.
wastewater going to your sump pump, and your sump pump kind of suck away all this junk. So you keep your sump pump, your cup empty. So while you're sleeping, that pruning process happen where you discard stuff that you don't want it, so you have more space to fill in the very next day.
Yeah.
If you don't do that, the water is gonna be overfill the cup, so which resulting in more irritable. You don't have capacity to store more memory. You don't have as good of a cognitive capacity throughout the day. So you do need to have that vacuum, that pruning process happening while you're sleeping.
And that happens in the deep sleep phase
Deep sleep and also REM sleep as
and
well.
REM sleep
Yeah.
as well.
Mhm.
Okay. Great. Now I'm thinking that I thank you for introducing the sump pump analogy, because not only is my desktop full, but I have a toilet bowl in my head.
See?
So you talked about the impact of poor sleep duration and quality, just sort of in terms of everyday life, mood, memory. What happens when we're sleep deprived or not getting the quality sleep? In terms of, like you mentioned, neurodegenerative disorders like Alzheimer's and dementia, we know so much now about the impact of sleep and the downstream effects on our neurological health. Can you tell me what is at risk here?
Yeah, so in terms of neurological impact, one of the bigger things is dementia development. People tend to, and obviously if you don't sleep as well, your cognitive capacity is definitely reduced. And we can all attest to that if we don't get a good night's sleep, our performance the next day tend to be reduced. One of the study looked at a amyloid plaque, which is the abnormal protein accumulated in our body, looking at how much they are being excreted, comparing good sleeper versus non-sleeper, and what their risk of developing Alzheimer long term. It turns out that people who don't sleep as well, they excreted less of the amyloid plaque. Therefore, it get accumulated in the brain, increasing your risk of having Alzheimer.
Would that also be, okay, my ignorance is showing, but I don't care, the same kind of plaque that would accumulate like in your arteries and such for like a cardiac event?
So they're a little bit different.
Okay.
So those plaque formation tend to, at least our belief, is causes by sleep interruptions, what we call hypoxia burden.
Okay.
Meaning that when you start breathing, and that's what most of the literature are indicating, is cardiovascular risk in someone who have obstructive sleep apnea or sleep apnea per se. So the patient have reduced of oxygen. They reduce their oxygen maybe from 95, 100% down to 70, 60%. So you have what's called a hypoxia burden. It damages your lining of your blood vessel, causing it to be roughened. And then the plaque can then accumulate and then kind of grow
like
from
it sticks
there.
on.
Exactly. So
Yeah.
you damage the lining. Think of it as a liner. There's a liner along your inside of your blood vessel, and it's really generally smooth. So your
slick.
blood vessel traveling all the red blood cell, there's platelet, there's white blood cell, they're traveling through that blood vessel is really smooth,
Yeah.
right? But once the surface get roughened, it tend to stick. And that's causes by sleep interruption, hypoxia burden, things of that nature. And then once it started to stick, it started to accumulate.
And that accumulation ultimately is what is an indicator of potential Alzheimer's, dementia.
Yeah, so those plaque formation in the blood vessel lead to a blockage
Artery,
of
like
the
heart
artery.
attack.
So that lead to heart attack and stroke.
Yes.
The Alzheimer is a different protein that typically get excreted as a pruning process. so they don't aggregate in your brain, but because of that process is reduced, it tends to stick in our body and kind of aggregate it in the area that is causing some memory problems.
Okay, so that okay. So that is why I'm sorry, I'm probably driving you crazy because I'm like skipping all over my questions, but there's like so good. Is that why people who don't have optimal sleep are at higher risk for stroke and heart attack?
No, absolutely. Absolutely. And it's not just that. There's a lot of literature are now suggesting that people don't get enough sleep. They also have an increased risk of cancer as well.
Okay.
Yeah.
Let's hear it for sleep.
Yeah, because, I think ultimately sleep does a lot of repairing work for us. Things that will get exposed, the toxin get generated, it all get kind of cleared out while we are sleeping.
So I want to actually again, I'm going off script, but I actually think this is related because we hear a lot, particularly in the season of adulthood, right? Or midlife, about how stress is so detrimental to our overall health and longevity. Do you think that there is a relationship between stress and your ability to sleep? Could they be related?
No, absolutely.
Yeah.
Absolutely. Right. So there's a term called physiological insomnia, where your stress is affecting your physiological response. If you are stressed all the time, your sympathetic activity tend to be heightened, which is the fight and flight response, right? It drive up your cortisol level, as you mentioned earlier, and those are fuel essentially for energy. Just like you're taking prednisone.
Right.
So if you have a very high
you're jacked up,
you have a high fuel level, it just allow you to less capacity for you to kind of wind down and be able to fall asleep.
Right.
Even if you do fall asleep, you're not in that deep state.
You're
of the
still
sleep.
worried about the saber-toothed tiger coming to eat you. Yeah. Even though it's not going to come and eat you, but there's that high level of vigilance.
Yeah,
maybe
for sure. And then it is okay to have few days of poor sleep due to stress, but if it lingers longer than normal, that starts to affect your lifestyle long term or your capacity long term, then that's when one should start seeking help. Yeah.
Okay. This is a question that has long been a debate in our house. If you are low on sleep throughout the week and then you get to the weekend and you sleep for 12 hours, is it like a sleep bank? Can you catch up?
It's gonna be really hard to catch up.
Okay.
I think the number I recall is every hour that you miss, you need about 4 to 5 hours to catch up your sleep.
Wow.
So it's better to maintain your car regularly rather than maintaining it every 2 or 3 years.
Right.
You can never maintain your car really well after things that's already accumulated, the damage is already done.
Right.
It's best just to do it regularly.
Right. Okay. That's okay. That's what I thought. But again, it was just a bit of a debate. So I get to talk to the sleep expert and ask these questions. So we've talked about technology. You've talked about modeling good behavior. Let's talk about what an optimal routine looks like for adults. Okay. That is modeling good behavior when it comes to sleep routines in general.
Yep. So in optimal time, it varies from person to person, but ideally, you should have a fixed sleep time and wake up time. If someone requires 6 hours of sleep, that's all you need. If someone requires 9 hours of sleep, your time should reflect the hour that you need it. Now, how do we determine that time needed? It's really depending on several different factors that people would know in general how much time they need to wake up feeling refreshed. So that's the time that we will tend to set for that particular patient. And obviously other things, other behavior that lead to a good night's sleep, such as not eating a big meal before bedtime, a couple hours, not a high fat or high carbohydrate content meal. You don't exercise heavily, like you don't run a marathon before you go to bed. Or
what about just the Peloton? No? No.
Yeah, you don't want something, light exercise is okay, but not heavy exercises.
A walk. Okay.
You don't want to drive up your cortisol too much to the point that it takes much longer time for you to kind of reduce that level to the level that you can fall asleep. You wanted to have a good sleep hygiene. Go to bed at the same time, wake up at the same time. You don't also wanted to have a good minimize exposure to electronics. Ideally 1 to 2 hours before bedtime, but that's really difficult to achieve. So often I just ask people to do half an hour at least before bedtime and use that time for something else. Now there's some people who are naturally a worrier, like they worry a lot.
Yeah.
Sometimes they worry about things that they might forget tomorrow. I usually ask them to set together some worry time. So start writing things down. And I tell them to just forget about it, because you already write down. You don't have to worry about not remembering it. Just write it down, whatever you have, and then write it down, and then just go to bed.
Okay. Oh, that's a really interesting practice. I'm not a worrier, but my husband is.
Yeah.
He's a ruminator. He'll like go to bed, and if he doesn't have his phone, he will think. Yeah. He thinks.
And I've done that too as well. Like sometimes I have a big project coming up, and I just keep on thinking, am I missing anything, right? And I forget that I'll miss what I'm thinking of right now. I'll just get up,
write it down.
I just write it down, and then it helps me, and I can just kind of drop it and go to bed.
You can relax. Yeah. Flip my paper here. So I want to and we're not giving this season of life its due, because it's really, really important. But as we age and as we get into later adulthood, the common experience is people sleep less, lighter, more fragmented. So why, as we age, and I'm talking like, or maybe you tell me, like I'm thinking like 70s, 80s. Like my mother-in-law lives in the suite below us, and she's a very, very light sleeper, and she wakes up at the crack of dawn. Why is it changing again? Yeah.
As we aged, we tend to require less of sleep. We spend less time in deep stage and REM sleep. And that's just the physiological process. So we don't really need as much of a sleep when we are older, which is important to recognize. Now, I also wanted to make a distinction that sleeping less is not equal to a poor sleep quality, right? You may be sleeping less, but you can still sleep well. One of the common thing that I heard from patients when they get treated is that they would say that I never know that my sleep can be this good. So sometimes we live with a poor sleep for a long time. It becomes a norm for us. So if we don't recognize that, we cannot make changes to improve the sleep quality. So one message I wanted to carry out to your audience is that you may have reduced the sleep time, but it doesn't mean that your sleep need to be poor.
Right.
If you have a poor sleep, you need to seek help or to have it addressed, to look at underlying cause of that. And it can be from different things. Like the most common one, obviously is sleep disorder breathing, which is obstructive sleep apnea. Right. It's very, very common. Yeah. If I screen everybody, I almost guarantee everybody will have sleep apnea. It's just a matter of how much they stop breathing and whether that causes clinical issues.
Right. Like, is it disturbing you?
Yeah, exactly. Yeah. So if it's causing any clinical symptoms in terms of waking you multiple times, not allowing you to wake up feeling refreshed, you have low energy level, things of that nature. If they have those clinical symptoms, they need to be addressed.
Okay.
There are other conditions like pain, for example, fibromyalgia, chronic pain syndrome, people who have restless leg syndrome because of a low iron content. I think those are common causes for sleep disturbance. If you can have them addressed, you can also help improving the sleep quality.
So what you're saying is that if you are struggling with your sleep, there are things that you can do, interventions for sure. And to go and talk to somebody like yourself, like a sleep expert, because it's so highly individualized as well, to really find out, like you're not stuck with that, right? You're not stuck with the hand you've been dealt. Like you can fix it. Yeah. Right?
Yeah, for sure. Yeah. And just one other scenario is that sometimes I see a patient who is elderly and they wake up, 3 or 4 o'clock in the morning, but they do go to bed really early. Yeah. But they also heard this, if you don't sleep certain time, you might have risk of deep Alzheimer. and they start worrying because they slept 4 or 5 hours and they feel great, but because the notion that they have to sleep at least 6 or 7 hours, they try to push themselves to sleep more,
right?
But that sleep is very fragmented and it's more poor quality, so they wake up feeling less refreshed. Yeah, exactly. So it's also important to recognizing where your limit is and what condition would allow you to have a best quality of sleep, and that really varies. So it really relies on your self-recognition, as well as work with a professional, with the family doctor, the sleep specialist. There are also people who specializing in sleep counseling as well that can help you to do that.
I've noticed that I am blessed with 2 sets of parents. Both sets are aging, and I don't know if it's like a male-female thing, but my stepdad and my dad both sort of like just will nod off at random throughout the day. And is that normal?
My instinct would be to say that it's not normal.
No, okay.
If someone, so there is a very simple scale. It's called Epworth Sleepiness Scale. So it's a scale of asking what are the risks of falling asleep under certain conditions, one of which is sitting inactive in a public place. So if your scale is, I don't know
if they do it in public, but they definitely do it at home.
Well, just in private, just sitting down, being inactive.
Yeah.
So if your scale is more than 10 and above out of 24, it's considered a pathological sleepiness.
Okay.
So nodding off all the time is not normal. Most people should be able to keep themselves awake, maintaining activity throughout the day.
Okay. Yeah. I'm glad I asked that, because we just sort of were like, okay, and I wouldn't say it's like pathological, like, but you know, if they're watching a dance recital that's 3 hours long, there might be a little nodding off happening.
Yeah, no, for sure.
Yeah. Interesting. So I would imagine, but tell me I'm wrong, that the same implications that we were talking about for lack of sleep or quality sleep in younger years, let's say midlife and younger, mood disruption, depression, anxiety, all of that, sort of that suite of implications would also apply for folks that are in sort of the later decades if they're not getting enough sleep.
Yeah, I think, in adulthood, it's the physical cardiovascular outcome that is more of a concern.
Yeah.
So normally when I look at the outcome of poor sleep, I will break that down into a brain health, their mental health, and physical health. So in adulthood, it's more of a brain health, Alzheimer, dementia risk, and also cardiovascular risk.
Right.
It's not just a heart attack and stroke, but other things as well. It also affects your insulin regulation. It affects your heart in such a way that it may causes a higher risk of cardiac arrhythmia. It may also causes a higher uncontrollable blood pressure as well. As mentioned, risk of cancer is also higher for some patient as well.
Wow. So as you very eloquently already outlined, that many seniors sort of attribute poor sleep to just getting older. That is not the case. And you've said that if you are sort of in those later decades and experiencing problems with sleep quality or duration, or you're just not feeling well or feeling refreshed, the message is get help, and maybe specialized help. I mean, obviously a trip to your family physician is worthwhile, but then also seeking out specialized counseling just with regards to your individual situation.
No, absolutely.
Yeah.
And I guess my last message for all individual audience, what the patients are, that take care of your sleep as you would for your heart and your brain. They are important, and you want to be proactive. You wanted to recognize early sign of, sleep disturbance, so that future complication can be prevented.
Well, I love talking to you, and this has been another really, really great conversation. It's so interesting to me that this topic, sleep, like, which seems so simple, is so not simple. Like, there's just so many different threads that we can travel down, you know? If our listeners could walk away with one change that they can make today, or one takeaway that will benefit their brain health, because you are a neurologist, and what we're talking about here is optimizing sleep ultimately to optimize your brain, what would it be?
I guess be mindful of your sleep quality. If you have any concern that your sleep is not as of a good quality compared to when you were young, seek help. So that appropriate therapy or investigation can be done. And it's always better to prevent than rectify the problem already happens. Yeah.
Well, thank you so much, Dr. Lai. It is
you.
always a pleasure to talk to you. I'm going to have to figure out a reason to bring you back for another episode because we always just have the best conversations. And now I just feel like I know so much about your life. We're going to need to catch up every once in a while.
No, absolutely. And I'm glad that I used the sump pump analogy. I guess this basement flood also has another positive note as well.
Yes. Yeah. We were actually, just so our audience knows, we were supposed to record this episode last week, and then I got the 911 message from Dr. Lai saying, my basement is flooded. Can we postpone our recording? And so we've been traveling along with him on his journey to figure out and fix his basement after the flood. So, and then now, thank you. I will always be thinking about the sump pump in my head. Always a pleasure, Dr. Lai.
Okay,
thank you so much.
Well, thank you so much. Thank you.